So just to introduce Dr. Maalouf, Dr. Monica Maalouf is a physician, associate professor of medicine, and associate program director for an internal medicine residency program in Chicago. She primarily practices primary care with a focus on marginalized communities and women's health. Dr. Maalouf earned her undergrad degree at U Chicago, completed medical school at the University of Minnesota, and did her residency training in internal medicine at NYU and Bellevue Hospital. And she is now leading PNHP's new communications committee. And I will turn it over to you, Dr. Maloof.
Hey everybody, thanks for that great introduction and great to see you all. So I'm going to talk to you all a little bit about social media and its, potential utilizations for advocacy movements. I just would love it. Well, thank you all for being here. I will tell you that back when I was a med student, I was in a similar space as you all are. I was involved in SNAP and in advocacy and in running our student-free clinic. And so these questions about how our healthcare system is run and financed were very much questions I was asking when I was at your stage of training. And they're questions I kept asking, and I kept finding ways to get involved outside of just like being a doctor, just like to be involved in advocacy because it just mattered to me. And now I'm, 8, 9 years out of residency, and it's a big part of what I do. So at my med school, I do a lot of advocacy work with our students and with our residents. Um, I'm actually one of our assistant deans of DEI. So through that role, I do like a lot of advocacy work. And then I sit on the board for PNHP and I'm running the PNHP's new comms committee to help continue that work. So I just want to let you know, like this being in this space right now, like matters, and hopefully it'll continue to translate into you all doing impactful work as you grow in your careers. And then since we're talking about social media, like I just want to let you all know that med student voices are so powerful in the social media space because there's a lot of you all, and you do a really good job at amplifying stuff. So I'm going to talk to you a little bit about social media. I've given this work versions of this workshop to like residents and other physicians in the past too. So I'm going to share my slide. Okay, let's do slideshow. Okay, let's share that on slideshow. Okay. You all can see my slides. Yeah. Okay. This is just like a really brief landscape, and it only goes to 2015, but I just think that it's so oops, hold on, let me just shrink my camera view 1 second. How do I do this? Okay, there we go. I just think it's so crazy to see like how in my lifetime like the rise and proliferation of social media. When I was younger in school, like none of the platforms we use today like existed. And then in the early 2000s, we started seeing the rise of Facebook as one of the true origins of social media as we know it now. So that was more than 20 years ago. And then in the last 20 years, we've just seen such a proliferation of different platforms and also the acquisition of different platforms by other platforms. And we've seen social media can be used for so many things in the healthcare landscape. So one of the ways that people use so there's a lot of different ways that people in medicine and science use social media. One of the ways that they use it is as a learning space to share knowledge. And I think in that case, it's important to recognize that this is like a revolutionary way to like share information. So it's really helped people across medicine learn. And there's a whole bunch of people who just exist on social media to use it as a learning space or as a teaching space. So people do things like share case reports about unique patient presentations, share articles, share studies, promote dialogue about controversial studies, having expert weigh in. This is the coolest thing for me because you can see like somebody publish an article about, I don't know, like acne, and then like the world leading expert on acne will comment on it and you can have a back and forth with them. And that has leveled the playing field in ways that we've like never seen before in history, right? Before, like if you wanted to talk to the world expert on these things, like there's no way to contact that person. You'd have to go to a conference and hope to pass them and hope to ask them questions about their studies. But it's sort of like leveled this playing field and given people who are just sort of like up and coming learners or young doctors a way to interface and ask questions of experts in the field that we've never seen before. So that's really cool. Real-time updates, so allowing people to share like data as quickly as it's being published. And then I put pandemic learning in here because this was something that I saw just unfold very real time in the pandemic, even though that was several years ago now. So these are just some examples of what we see. Like people will do morning reports or journal clubs. The hematologist, she's famous for kind of posting a lot about hematology and anemia. So she will present cases and promote a conversation about that. Um, and this guy Raul Ganatra basically like presented a study, and he's like, "Hey, let's walk through this journal article together and like have a conversation about it." So those were both very like successful ways, and would get a lot of traction on social media. This is some of that expert opinion, Dr. Rasmussen, who's like a virologist, who posts a lot about viral studies. And so some of this is very granular, right? Like this is not meant for all of the internet to be consume this data about, that's like published in Science Magazine. But she breaks it down in this digestible way for a scientific audience, and then tags other epidemiologists and scientists to engage in conversation with her. This is some of that pandemic learning. This is just like one example of stuff that was happening during the pandemic. This is like old news now, but at the time, this was so groundbreaking because the COVID pandemic started and we were seeing all these patients come into the hospital. I was practicing at our hospital at the time. And like we literally had no guidelines. Like we didn't know how to treat COVID. We didn't know how to manage these patients who were coming in super hypoxemic, needing lots of oxygen with crazy labs and crazy x-ray findings. And they were all really sick. And so people started posting, hey, like I've seen 25 cases now. This is what I've seen. This is what works. This is what doesn't work. So this intensivist in Seattle, who was running one of the big ICUs in Seattle at the time, created this one pager. He's like, hey, this is everything that I've seen that's helped my COVID patients. And, this created a lot of dialogue because this is just one individual from their one experience. But at the time, that was all we had to go off of because our expert organizations didn't have enough data to publish standards at the time. So it was a way for us all as a physician community to have this big dialogue about how to manage a new disease in a way that was just like unprecedented. So he made this handout that ended up like circulating like wildly on social media and was used by a lot of people. It was very interesting. So that social media is like a learning space, but social media, what we're going to talk about a little bit more today is how we can use social media as an advocacy space. So using social media as a tool to promote your message and ideally that being a message that is in support of a cause. That's what we mean when we say advocacy. Advocacy tends to be supporting a cause rather than supporting an individual. Um, and there's a lot of different ways social media can be used for advocacy. It can be used to amplify movement, so like raise awareness, get more people involved, creating space for conversations, using thought leaders or influencers to help push agendas forward. So that means is like getting people who are again like expert opinions or well recognized as influencers, either in your movement space or in other spaces to just get to talk about this issue. So for example, getting somebody famous to talk about Medicare for all helps raise awareness about it and get more buy-in. And then gaining attention of community and institutional leaders to push forward change. So I'm going to share with you just some examples of what that can look like. There's so many different versions of what this could look like on so many different scales. So in 2021 was the first time we saw Black match trends. So raising awareness of Black people in medicine, underrepresented population in medicine, right? Only 3 to 5% of graduating medical students are Black. So creating this trending, what a surgeon looks like. Black match 2021 was the first year that we saw Black medical students posting pictures of themselves, celebrating their match. And just that simple movement gained so much traction and helped create representation, help students, med students, residents, and just the lay public understand what it looks like or what it means to be a Black physician, a Black graduating student today. So that was a movement that really took off, and that hashtag still is something that is used today. Um, so that one was started by med students back in 2021. The Med Bikini movement. Do any of you guys remember this? Do you guys know about this? Okay, I don't know. This one was like a huge one back in 2020. This was about 5 years ago now, but um, This one was a really pivotal moment because it was the first time I think the entire like social media ecosphere got together in a way that created such an intense movement that it forced a journal article to retract what happened. So basically in 2020, the Journal of Vascular Surgery published a study about professionalism in medicine. And one of the metrics that they used to gauge professionalism was like if female physicians had pictures of themselves in swimsuits online and bikinis online, they said like that was unprofessional. And so that was like how they like measured professionalism in this study. And so it was this like sort of like article that you think that probably not a lot of people would have read in this Journal of Vascular Surgery, but a handful of like students and residents and physicians found this article and were like, this is a preposterous metric for professionalism. And like, it's unbelievable that like a big medical journal would publish this. So that led to the med bikini movement. So this was a trending hashtag in 2020. And hundreds of doctors, if not thousands, of female physicians and male physicians started posting pictures of themselves in bikinis online to disrupt this idea that like being in a bikini was unprofessional online as a physician. So tons of doctors started doing it. It gained traction and not just on social media, but then in big news channels. Where they were talking about like med bikini emerges, like young surgeons so white doctors and med students are posting bikini pictures. So it became this big trend, gained a lot of traction. People were writing about it in big newspapers and in local papers. And ultimately, we saw a positive response. What happened was the journal actually redacted the study. The editors of the journal published a statement. Um, and they said many who've read the article expressed great concerns about the methods of data collection as well as the bias. And so then they said at the end they've decided there was sufficient rationale to retract the article. So this was a really cool example of how a few people noticing like some like bias in medical literature created a social media movement, amplified it to the point where it caused professional organizations to change and retract this article. So that was one example of a successful social media movement. During COVID, we also saw a lot of equity work being done through social media. So Alice Stanford, who founded like the Black Doctors COVID Consortium to help raise awareness about COVID and the COVID vaccine in the Black community, ended up getting traction and a lot of attention from the media and Congress and funding in order to be able to support getting vaccinations to the Black community. The COVID pandemic was the first example in US healthcare where resources were being directed specifically to Black communities prior to or at equal rates as like other communities. And it was because of a lot of these media efforts raising awareness about how usually when groundbreaking medical research happens, it is not being sent to underrepresented and marginalized communities first. It is being sent to, wealthier communities first, and then eventually makes it there. But that was disrupted in the COVID pandemic because of movements like that, those of Dr. Stanford and other physicians across the country um, who were amplifying the need for us to help support marginalized communities first. Um, and so, um, so one of the council people in Philadelphia celebrated the 25,000 Philadelphians vaccinated as part of this effort early on, and we saw a really good uptake in vaccines in the Black community. And later on, and I don't have this in these slides, but we would see later in the pandemic um, Black mortality in the COVID pandemic was better than white mortality, and some of it is attributed to some of these vaccine equity projects that were being amplified really through social media landscapes. Medicare for all, obviously the reason we're all here, why I'm here. But it's a great advocacy tool. And a lot of people use social media to help amplify the message of that. Dr. Glaucom Flecken, who's like a famous, like an influencer ophthalmologist, he's gotten a lot of traction from posting like kind of funny stories about his healthcare experience. And then other advocacy groups, organizations like Public Citizen, post and publish data about Medicare for all. And then we're hoping to make PNHP a big player in that landscape coming up as well through our social media committee. And then I'm going to share one other like interesting social media success story. Sorry, give me 1 second. I just got a page. Let me make sure it's not urgent. Okay, it is not. Okay. So American College of Physicians, which is like the governing body of the Internal Medicine Organization. So I'm an internist. So American College of Physicians is one of the largest physician organizations in the world, probably more than 20, 30,000 members. And so basically, for a long time, physician organizations did not weigh in on, gun violence in the United States. In 2018, the ACP published a policy paper, a position paper from the American College of Physicians about reducing firearms injuries and deaths in the United States. Um, and the paper basically summarized the mortality and morbidity associated with gun violence in the United States. The paper called, they said that it doesn't threaten the Second Amendment to keep guns out of the hands of felons, domestic violence abusers, persons at risk of harming others, and they called for background checks, close domestic violence loopholes, require safe gun storage. They're prohibiting sales of assault rifles, and to study causes and solutions to reduce injuries and deaths. At this time in like U.S. history, there was actually a federal ban on studying gun violence in the United States. So there was a restriction on spending federal funds to study gun violence. So this paper, when it was published in 2018, basically called for better gun reform, better gun control, and increased studying of gun violence in the United States. Um, so in response to this being published, the NRA, National Rifle Association, tweeted saying that physicians should, quote, stay in their lane, and that like gun violence is like why are doctors talking about it? You should stay in your lane. So this prompted the quote, "This is our lane" movement. Have any of you, were any guys aware of this movement? I don't know. Some of you all are probably pretty young when this happened, but this was like 2019, 2020. Um, so um, so this was the like tweet from the NRA. They said someone should tell self-important anti-gun doctors to stay in their lane. Half of the articles in the annals are pushing for gun control. Most upsetting, the medical community seems to have consulted no one but themselves. Um, so the ACP, the ACP or annals public or posted a response on Twitter. Um, and they said, tell the NRA to stay in its own lane and out of the exam room, take a stand today, and to talk about, gun violence and healthcare. And so that led to a robust and wide social media response from physicians. A bunch of physicians across social media were posting, we're not self-important, we're here to take care of others. We're not anti-gun, we're anti-bullet holes in our patients. Um, Trauma surgeons across the country began posting, and then we saw residents, med students, ER docs, people from all across medicine sharing stories with like bloodied scrubs from taking care of people who are victims of gun violence. So this was known as like the "This is our lane" sort of social media. That was like the hashtag that was trending for several weeks. People showing pictures of bloodied ORs, bloodied trauma rooms with people coming in from gun violence. Um, and this was, I can't remember, I think this might have been a nurse who said, "Why in the hell do you think they might have something against guns? Sort of like the trouble you have with human life. This is our lane, gun control now." Um, Here's hoping that the NRA realize that this is reality we face. We seek solutions, we won't quit. Our like lives depend on it. So physicians across media, nurses, healthcare workers, medical students, residents were posting pictures showing like this is very much our lane. This is the type of violence that we see. And then this movement again went from social media to traditional media. So CNN, CBS started posting about what's been going on and talking about gun violence as a public health crisis. Media platforms across the United States started talking about the quote Twitter war, doctors clashing with the NRA, doctors speaking louder on gun violence. So, as a result, after a 20-year drought, lawmakers finally approved funding for the first time in 20 years. And this was actually done under Trump 1.0, um, to allow the NIH to conduct research on gun violence in the United States. Now, this wasn't solely the work of just this movement, but this movement helped amplify the conversation, get people in Congress talking, help get people in front of the right Congress people to push forward this change in legislation. So I think this is an example of like an amazing social media success story where, again, like using, you know, your voice and your sphere of influence to push forward the conversation, talk about things in a thoughtful but critical way, and ultimately led to changes in legislation. Okay, I'm gonna pause there and see. I don't know, do you guys have any questions or comments or all right. Well, feel free to like unmute yourselves and chime in, or we can have questions and conversation at the end.
Do you want
Uh,
to stop share so people can see each other's faces while you have a
oh
conversation?
yeah, we could do that too. I don't know.
So
People.
I'm thinking that the NRA kind of shot themselves in their foot because you not would not have gotten
Yeah.
that same level of publicity without them.
Yeah, absolutely. That was like a really interesting, it was like they had like a sort of a snarky quip that led to basically like ignited a movement. So I think you're right, Betty.
This is a general question. I don't know if you know the answer, but when I was looking into med schools, a few years ago, I remember looking at like different clubs and a couple schools had um, like doctors with gun. I don't know, that's not the name, but like doctors that own guns and like believe in the Second Amendment right, but want to advocate for better gun reform. I don't know if you know if they've had a big impact on this kind of a movement or if they're involved in the research, because I do feel a little weird if the NRA is conducting the research themselves. I feel like it's a
Oh, yeah, no, so that research funding went through the NIH. It
oh,
wasn't just
NIH. Okay.
yeah, the NIH, the National Institute of Health and the CDC. So now that was 5 years ago. I actually don't know the update about like what's happening with that funding now in time, but like at the time it was very much groundbreaking. So it was paying scientists, physicians, researchers to support their work to study gun violence.
So I would actually like to comment on the use of the words gun control as a messaging issue. That if you say gun safety, it doesn't grab people quite so hard. They don't get as riled up against it. You say gun control, it's like you're trying to control me, you're trying to control my gun, my rights. But just using the word gun safety can calm it a little bit to have more of a conversation.
Yeah, you're getting into the sort of a little bit of the next part is like how do you message effectively on social media and in the ecosphere? And I think that some it's really interesting. And now that I'm like, thinking about this for PNHP, I literally have people telling me their opinions on both sides of the spectrum. Some people are like, you don't want to come off as sounding like too radical. And then some other people are like, no, like we should be very radical and like take our stance. So I think that the interesting thing about social media is that you're talking to everybody. You're not talking to, I'm not like walking into a classroom where I know, oh, I'm speaking to teachers today, and so I have to tailor my message to them. Or I'm speaking to, well, right now I am speaking to med students, and this is how I message to med students. When you post on social media, you're not speaking to one audience, you're speaking to everybody. So do you tailor your audience for everybody? Or are you like, I'm going to put out a message, but I know this is who I want to reach. I don't care to reach these people, so this is how I'm going to adjust my language accordingly. So there's like a lot of that goes in there. Hang on one second. I have to grab it. Ooh, sorry, getting over a cold. Um, okay, so I can share my slides again as we're on this topic because we can talk about how do you like message on social media and like what are some strategies for success. Um, so um my first tip is you're thinking about if you all are thinking about like how to get into social media, how to like convey messaging and tell us to get your word out is to use narratives, use stories. Your voice in social media matters mostly because of like who you are and what you have to say. And so now that you're like medical students in the medical space, like your voice as a medical student matters a lot. Your future physicians, people recognize that you're very smart and very successful to have gotten to where you are. They recognize that you know things about patient care that most other people don't. And so they don't want to hear just pieces of data. They want to hear stories and perspectives that only we have insight into. Um, so when I talk about single payer and healthcare for all, I oftentimes ground it in patient stories. So this was just like one example of a thing that I tweeted, like when I told a patient, like, we should do an EKG today, make sure your heart's okay. And my patient said, well, I can't afford it right now. So I've been paying everything out of pocket. So rather than saying, like, posting a fact, like patients can't get studies when they don't have health insurance. Sorry, give me one.
A really hard thing is patients just deciding to not do anything because they have no idea how much it will cost and whether they can afford to pay for it out of pocket.
All right. Sorry, team. We're struggling through this one today. Okay. Yeah, so sharing stories, but the other thing I'll call your attention to about this story that I've shared on media was that I didn't say the age, the name, the race, or the name of the patient. So being very cognizant about protecting the identities of like the stories you'll share. I will often share stories and comments about like pseudo patients. So if I'll see something in clinic, I'll sort of create a story that isn't that exact case so that um I'm not giving away who the patient is if one of my patients were to see this post. Um this is just another example of a post I made, like where the patient who had a history of cancer, who said, like, I can't schedule my MRI right now, I still have too many bills. And the thing to remember about stories is they're powerful, they resonate, and they're easier to remember than facts and figures. They're also easier to share. And when people like repeat, oh, I saw this tweet online, or I saw this post, or I saw this Instagram or this TikTok, they're never gonna remember the data pieces, but they're gonna remember the theme, how it made them feel, the story behind it. So one of the successful strategies you can use on social media is to share your story. Yeah. These are just a few other examples of things I posted. These were kind of just retweeting other people's stories and healthcare denials and people posting about like burnout in medicine and feeling like burnt out during the pandemic. This was stories of other physicians and nurses. The other important thing about social media is that visuals matter. So as you're thinking about how to post, grow your message, get your voice out there. A few tips that I have for people is pictures over links. So what I mean by that is rather than saying this is an interesting article and posting the link, screenshotting the headline. So this is often how I'll post. I'll post a screenshot of the headline, and then underneath that in the comments, I'll post the link so that people can find the full article if they want to read it. It's because headlines are more attention grabbing, photos with bright colors are more attention grabbing than just merely posting a link. And sometimes the links get hard to read and it's hard to see the headline. um, and this is another example of somebody who, got 150,000 likes about him, grabbing several headlines and like posting them. So again, the power of like posting headlines, screenshots, rather than just posting links to all these articles. So that is creates a visual that's more attention grabbing. The other tip for posting, especially in the scientific landscape, is like I post a lot of journal articles. And journal articles are dense and they're hard to read through. And so I'll show people where to look. I'll do the same thing if I post any article really or any story, is I'll take like a little red marker on my phone, circle where I want people to look. Like this one, this new study confirms the volume of my chart messages has surged, and I'll circle like where people should look. Um, and here, here the conclusions. PCPs don't have enough time to write. So I'll provide clips of the whole article. I'll provide the link in the comments, but I'll highlight the takeaways so that people, when they're looking at the post, know, oh, this is the data that I want to remember, or this is the piece that I want to focus in on, rather than the whole article, which is sometimes like people, as their attention spans are shorter and they're scrolling through, they're not gonna really read the whole thing, for better or worse. So, whenever I talk to people about posting online and trying to amplify messaging on social media, I always tell them that it's really hard to be successful at it. I'm like, I would say very mildly successful. I have like, a few thousand followers. um, at some point, I had a bigger following on Twitter before I deleted my Twitter. But and in going through that exercise of like being involved in social media, getting a lot of attention and having a lot of followers, I realized that it's a really hard game. And to remember like why you're doing it, and recognizing that sometimes you're gonna have to experience what I call the no likes blues, which just means sometimes you're gonna post things and no one's gonna read it, or like five people are gonna read it, and that's okay. Um, it reckons back, it like makes me think of like the old school, the Agora, which was the ancient version of social media, which was the marketplace in Greece where everyone used to come and people used to try to get attention by standing on a box, a literal soapbox, right? That's where the phrase comes from, right? To stand on a box and yell out into the marketplace and hope that people will listen to you. And sometimes you're going to be yelling in a soapbox and everyone's just going to walk by. And that is just life, and that is also social media. So sometimes you're gonna be, shouting into the void. Um, that's okay. Sometimes you're gonna post and people aren't gonna like it and people aren't gonna see it. But if you really want to get your message out there and you really have a story to tell, I think it's still worth putting it out there. And sometimes it's not your specific moment in that day or in that time or in that week, but it's okay to still share your story. Um, your voice and your opinions still matter. And sometimes it is just cathartic or therapeutic to just talk things through, share that story, put your voice out in there. And like one example I give everyone is that, sometimes Obama posts and nobody reads it either. Like he has like hundreds of millions of followers and like sometimes he only gets a couple thousand likes. So if you are, a junior amateur starting and you only get like 5 likes, that's pretty good. It's pretty okay. See, I'm showing you guys where to look. Okay, the pitfalls of social media. So it doesn't come without risks. So HIPAA. You guys hopefully all have heard of HIPAA at this point. But really, the important piece of HIPAA is recognizing that your patients deserve respect, privacy, and protections. And so, if you're going to be posting anything on social media, you need to think of the patient first. So I almost never post photos from the hospital. I pretty much never do. The reason is because there's things in the hospital everywhere that can betray like a patient's, if a screen is in the background, if there's a sticky note on my desk, if there's a piece of paper there in the background that has the patient's information on it. I don't want any of that on social media. So I almost never post pictures like from the hospital. This was a group of residents who actually lost their jobs. They posted pictures on social media, like holding up. Um, I think they took out a tumor or like a fibroid and like they posted up and like, can people guess how much this weighs? It was like kind of silly. And there was like patient information in the background. But also I think beyond that, like when they lost their positions, it was just like the spirit with which it was posted was not like it was like it wasn't posted for like good intentions. I'm unclear like why they posted it. Um, but this happens every year. There's stories online. You can look them up. Doctors, physicians, residents, med students losing their positions because of like stupid mistakes on social media. So tread very lightly. And this is my general tips is time out before tweeting. So before you actually click send, take a time out, pause, and think, okay, like who am I trying to reach and why? Um, So, like, am I trying to send a message? Am I just trying to vent? Is this better served with me texting my friend? Should I just call somebody about this? Um, I think that having that brief pause is really important because sometimes there's something that actually is just like you wanting to vent or rant or offload, and that is not necessarily the best thing to post in social media now that you're professional students. Um, so I'll give you an example of like some students got in trouble a few years back for posting like negative things about their medical school. I don't think they actually got like dismissed, but you're like a professional student, you belong to this school, so like going online and saying, "Oh, my med school sucks" is probably not the best thing to do, right? Just kind of thinking about thoughtful ways. Why are you trying to do this? What are you trying to get out of this? Um, and I'm posting it thoughtfully. If you're going to share a story about a patient, post the pearl, not the patient. The pearl is sort of like the learning nugget, right? So similarly to my post about um, my patient not being able to get an EKG. I didn't say anything about the patient, but I posted the takeaway point, which was my patient couldn't get what they needed because of cost. Um, and so that is sort of a good sort of reminder as if you're going to share stories about the clinical setting. Always cite your sources if you're going to post articles, and then consent, meaning like don't ever post anything about other people, anybody, without their consent. The American Medical Association does have guidelines for professionalism and the use of social media to echo a little bit what I talked about. You can see the full post online, but generally it sort of echoes what I said, which is protect your patients, be cognizant of privacy and the patient-physician relationship, be collegial, make sure people know your conflicts of interest, and maintain separate personal and professional profiles. I don't know. That one is, I think, probably like you can do at your own discretion. Um, the one other thing I'll say about this is confidentiality is a piece of like protecting patients when you post online, but you also want to like maintain your own integrity as a future physician. So like you don't want to post stuff that is going to make people be like, why would I go to this doctor? Because people Google their doctors, they look at them on social media. I have patients who are like, hey, Dr. Blue, if I follow you on Twitter, I'm like, oh God. But recognizing that like a lot of my patients look me up, see me online, I don't want to be posting things that is going to make them doubt my integrity as their doctor. So I don't want to be posting like, oh God, patients are the worst and they're always complaining. Like that would be a terrible thing to post and like would mitigate. But I have seen physicians or like, nurse, other healthcare professionals post things in that spirit. And you just want to be sensitive to like you want to still maintain your professionalism and make yourself somebody people want to see as their physician. So that's not necessarily illegal or breaking any rules. It's just like smart conduct. All right. Those are kind of like that's like all of what I have for you guys. What questions or thoughts do you guys have? Do you guys use a lot of social media? Yeah. What platforms are you guys on? What do you guys use these days?
I could answer that a little bit. A lot of people, well, I use Instagram a lot. I feel like that's probably the most used social media platform I have, and like that a lot of my friends have. TikTok, I think, is also a big one. I don't use Facebook or Twitter that much anymore. I barely even open those two. I don't know about anyone else.
Yeah,
Oh,
same for me.
yeah,
Oh, sorry, Zach.
you
Go
go
ahead.
ahead. Uh, just because she didn't mention this one, I do use YouTube Shorts, and although there's maybe not as many, I do know some people our age that also primarily use YouTube Shorts as like social media.
Yeah, echoing both of them. I'm primarily use Instagram. I only ever open TikTok when a friend sends me a video that they want to show me on TikTok, but I got into big TikTok rabbit holes during COVID, so I had to make sure not to go open the app too much. And yeah, for Facebook, I really only use it for Facebook Marketplace, and that's about it. But YouTube Shorts, I've recently discovered it, and I think it's really cool.
Yeah, I don't have I deleted my Twitter after Elon Musk bought it, and then I deleted my Facebook like 10 years ago. Um So I only use my husband's Facebook to post on Marketplace. And so my husband got mad at me a little while ago. He's like, all the things you're selling are like jewelry boxes and like shoes. And he's like, it's not meshing with my vibe. It's like, oh yeah, I never really. So, yeah, so that's my experience with Facebook. How about you guys, Mackenzie, Natalia, what are you guys using?
I have accounts on a few different platforms, but a few years back, I kind of stopped using social media. I found myself going down rabbit holes and spending too much time, and it's like I've lost privileges, so I don't really use any social media, but I am familiar with it. But I do sometimes feel like an old lady if my friends are like, I can only post like 10 photos at a time. I was like, you can post that many? I was like, I don't know how it goes. So I'm happy to get some more education about it.
Yeah, I'm mostly on Instagram. I don't really go on Twitter or I don't have a TikTok. More recently though, I've been going on Substack a little bit.
Okay, awesome.
How about
Yeah,
Reddit? Are
I,
people on,
yeah, sorry, go ahead, Betty.
I was just wondering if people are on Reddit. Like, they even count that as being social media because they're just so used to using it? I don't know.
Yeah, it's interesting because I feel like Reddit is a very common place for a lot of people to use, but I don't know if they count it as social media. Um, I think Reddit's more of like a forum. Um, yeah, it's interesting, Mackenzie. I got rid of a lot of my social media back when I was a med student. Like I got rid of my Facebook and like all the other. I used to have like a Zanga. That was a thing you guys probably haven't even heard of. But all my social media at that time because I felt like it was making me a worse person. And then I rejoined social media really for like advocacy stuff. So 90% of what I post now is not, I don't post anything about my life, my personal life. It's all like for the spirit of advocacy. So it's sort of pivoted why and how I use it. I think that there's a lot of, I didn't talk about like the personal pitfalls. So I was focusing a lot on like advocacy in this talk, but I think there's a lot of harm that social media can do to your mental health. So like protect your peace. I totally get that. Um, yeah. None of you guys mentioned Blue Sky. That's the one platform I'm using a lot now. Any of you all on Blue Sky?
Yeah.
A lot of people, I would say a lot of the academic and news and medicine people who left Twitter are on Blue Sky now. So it's a growing platform. So I mean, it's got like 30 million people on it now or something like that. But so it's sort of like it's like the new Twitter for people who have left Twitter. Um, yeah. So that's kind of all I had to chat with you guys about. Thanks for listening in, and I hope
Did we,
that it gave you some ideas for how you can use social media if you choose to get engaged with advocacy on that side.
did Trinity or Anana have anything more to say? Yeah, okay. So people have been just kind of popping in, but there were a couple people with hands raised, politely waiting. So Inanna, do you want to, Trinity, do you want to go next?
Yeah, sure. I just had a quick question. Because there are so many platforms, and I was gonna ask that right before you brought that up, but in terms of like with the PNHB communications team or just in advocacy in general, how do you kind of change your content across using all these platforms, but keep your messaging consistent?
Gosh, isn't that a great question? There's like entire industries dedicated to this, right? That's why like people are hired to do this stuff, because it's so hard. And to translate your message from text to visuals to film to is just like so complicated. I'm an amateur in this space. There's actually whole programs and masters now in like social media and influencing. I was at a recent talk, like a community panel, and and there was a woman who teaches a master's level program on social media at like one of the universities at DePaul University in Chicago. So it was just like really interesting to like see that, like listen to her speak because it really is an entire course of study right now is how to be adept at doing that. I don't think there's an easy answer, but I think that just being really mindful about what you're posting and how to create cohesive branding and cohesive messaging, it's just a challenge.
Inanna?
Thanks, Dr. Keller. I kind of wanted to ask, you mentioned keeping personal and professional profiles separate. So would you ever like, I'm assuming you're posting most of your advocacy stuff on your professional one. And then, but how do you start your professional one? Like for me, I have personal Instagram and social media accounts, and then if I were to start a professional one,
Yeah.
I guess I just don't know where I would.
Yeah, great question. I mean, this was a recommendation from the AMA standard, so you don't have to do this, but it does get a little tricky when you're like trying to talk mostly about like let's say Medicare for all, and then you're also like want to post about your dog or your cat and your vacation, and like share vacation photos. So it does kind of like get a little, it's not like a bad thing, but again, it's like kind of calling back to like the spirit with which you're engaging in social media. And if your whole goal is to just like, hey, I just want to post cat photos and vacation photos, then like that's fine. But if you want to build up an advocacy platform and do that, then what I would say is it's not a bad idea to create another account with a slightly different name or or like put your title there, have like Inanna as your one, and then med student Inanna as like your other profile, and then post about medicine and advocacy and all of that. I only, like I said, I only use social media for advocacy, so for me it's easier. I don't have a personal presence on social media, so you will not find my vacation photos there. So yeah.
Zachary?
I guess this is more related to your role as like a program director for the internal medicine residency. How would you, I know you can't generalize this, but what would you view social media like if you had an applicant who listed it on like their ERAS or something like that? Is it,
Yeah, I mean, we get like 3,000 applicants for our program. And so I never look at anyone's social media. None of us on the leadership team do. We don't have time for it. Um, so the short answer is, it's not an issue until it becomes an issue. We have had one or two residents get in trouble, not in a severe way, but post stuff that probably was like inappropriate. And then we had one of our residents, somebody tried to dox one of our residents, and then they reached out to us and they were like, "Did you know your resident posted this?" And it created a whole thing. So like that's come up, and we've had to have like conversations with the residents and talk about professional use of social media because now they are representatives of our institution. Um, and I guess I'll just share with you guys. The resident posted an offhand comment about how somebody should kill Donald Trump. And then um and then somebody like people came and started contacting our institution, was like, this guy's employed here. He's calling for someone to assassinate the president, like da da da. So we had to have like a really serious, like it was a whole series of committee meetings with this person and with our leadership team and with our legal team to figure out like what to do. So ultimately, like the resident was fine, but like don't create those problems for yourself. Again, recognizing that now you are professional students and like soon you'll be physicians employed by somebody, and our employer could have chosen to terminate him for that, but they like did it because it technically violated like the institution's social media policy. So the short answer is we are not like as program leaders, we're not in the business of like looking up every applicant's social media because it's just there's no way that we could do that now. But there it will be an issue if it becomes an issue. So being mindful of what you post and um from here on forward. So
So, so that's one approach, is that you don't look up anybody, but I could easily see you can't look up everybody if you have 3,000 applicants, but if you've narrowed it down to 10 or 20, you could
yeah,
look at those. And there will be
sure.
schools where some people will, or like somebody on the team may.
That's
So,
true. I also will say that like employers often will. So actually when I applied for my job, even like now, like 10 years ago, they asked for my social media handles. So a lot of times employers will, is that's different because they're hiring one or two people for this job. They're not hiring thousands. So
right.
employers will often ask for social media handles now. Um,
And when you're a resident, you are an employee.
All right.
So thank you so much.
Yeah, thanks for listening. Good luck, you all, and feel free to follow me on Blue Sky or Instagram.
Thank you.
Take care, everybody.
Yep. Bye-bye.